Hello everyone, welcome to NEFCO YouTube channel. So in our YouTube channel, we regularly post educational videos on point of care ultrasound, that is focus in NICU. So therefore I would request everyone to subscribe and like our channel. So in this case that we are going to discuss today, this is a term baby referred to us by a pediatrician because the pediatrician heard a murmur. So we will show you some small videos, clips, and then we will discuss what are the findings that we have seen in this baby. So I will just show you that we have done few views. So I will just show you the probe placement for one particular view that is important in this diagnosis, and this is what. So here we are keeping it at, it is a low parasternal view, so that is a parasternal long axis view. So we will discuss the videos regarding that. Even though I have shown you the probe positioning for plaques view, that is parasternal long axis view, but we will start with apical 4 and 5 chamber view. You see here, so this is your 2D and this is the color Dopplers in apical 5 chamber view. This is aorta, this is interventricular septum. And here in color you can see this color is crossing the midline, this interventricular septum. Going from, there is red and blue jet you are seeing. So that means the bidirectional shunt is there. The red is left to right, blue is right to left. And there is this clear defect in the interventricular septum you can see. So this is just below the aorta, so it is subaortic. Some defect is there, but as this interventricular septum is parallel to the ultrasonic wave, so this is not the right view to comment upon the size of this interventricular septal defect, that is VSD. And so now this is parasternal long axis view, and now you can see the heart is being cut in longitudinal section. So now this is your interventricular septum and this is aorta, and just below this aortic valve here you can see this defect. So this is your subaortic VSD is there. The murmur the pediatrician was hearing was because of the flow of the blood through this VSD, interventricular septal defect. So if you put a color here, you can again see here is the probe. This you can see predominantly red color jet is going through this defect. That is, red means left to right shunting, blood flowing towards the probe. Blue is away from the probe, so that means it is right to left shunting. So there is subaortic VSD through which this blood flow is you can see in parasternal long axis view. This is in now a parasternal short axis view. This is what we call as Mercedes-Benz view. Here you can see this is aorta, base of aorta in cross section. And if you have subaortic VSD, then you see the defect here from 11 o'clock to 7 o'clock. 7 o'clock to 11 o'clock position. Here there is a defect. So that again tells you that is a subaortic VSD. So in color also you can see here, if you color, this is a defect and the flow is red, that is left to right. There, this one you can see. So this is your subaortic defect, and this you can see the color flow going through this left to right defect through the VSD. And this is the size of the VSD we have taken in parasternal long axis view. You can take the size of the VSD in plaques parasternal long axis view and parasternal short axis view, because here the septum is perpendicular to the ultrasonic waves. And now this view I am showing, for those who cannot recognize, this is the arch view and I am doing the arch view. So now I will leave you with the question that why I am seeing and concentrating on the arch view to rule out what, because that defect is if you have a VSD, then you have to rule out that particular congenital heart disease because they can coexist very commonly. So this is the question for all the viewers. So you can write down in the comments when you see this full video and the case. Thank you very much.